everyone. Thank you so much for joining us. My name is Caitlin Yancey. I am the Associate Director of Government Affairs at Iraq and Afghanistan Veterans of America, and I am here joined by Dr. Rachel Earls, Senior Medical Scientist for Myriad Genetics, and Bryant Brooks, who is a patient of Myriad Genetics. I would love to give you, Dr. Earls, a chance to introduce yourself.
Thank you so much, Caitlin. Hi, Dr. Earls. Pleasure to be here today. I am a neuroscientist by training, and I work for the medical team at Myriad Genetics, which is the maker of the GeneSight test. Thank you for having me.
Thank you so much for joining us. And I do want to just have a disclaimer that today we will be discussing mental health and PTSD, depression, anxiety, ADHD, and more. And so if at any time you feel uncomfortable, please feel free to leave the live. Additionally, if you are in need of help, IAVA has a comprehensive case management program called our Quick Reaction Force. And it is a 24/7, 365-day comprehensive case management program that any veteran or veteran family member is able to reach out to. So if you are in need of assistance, call 1-855-91-RAPID or go to quickreactionforce.org. Additionally, if you are in need of immediate attention, feel free to reach out to the Veterans Lifeline, which is all you have to do is dial 988 and press 1, or you can text 838-255 and get immediate help. Let's get started today. I'm really excited to have this discussion today. As many know, IAVA has made mental health and suicide prevention the pillar of our advocacy efforts. We've had a lot of great wins in the recent past. The Commander John Scott Hannon Mental Health Care Improvement Act was passed at the very end of 2020, which was a great passage for the mental health care efforts. And then additionally, as I just listed, we recently saw the implementation of the 988 lifeline for anyone who is experiencing thoughts of suicide, and they can reach out to that number directly. Definitely simplifies that whole process from having to dial a very long number to just a 3-digit number. So let's get into it today. Brian, I have not given you a chance to introduce yourself, so I would love to hear about you and kind of your mental health journey and what brings you to the discussion today.
Hello, everybody. My name is Brian Brooks. I am someone who benefits from the GeneSight test, and that's part of the reason that I'm here, and I'm happy to share my experience. I live in Minnesota. I am married. My wife, Lynn, and I have been married 27 years. She's the better part of the marriage by far. I have a 16-year-old son. He's a pretty awesome young man. We were having snow, so it's his first days driving in snow because he's a new driver. So he's made it so far. So that's great. I am a hospital chaplain. I've been a hospital chaplain for about 27 years. And my story with mental health is around some early childhood adverse events that I experienced. And there is a correlation between adverse child events and depression. And then when I was 19, I was diagnosed with bone cancer. At that time, survival rate was not very good. It was a very traumatic day to be told you have bone cancer and they don't know if you're going to live or not. Did a year of chemotherapy, some big surgeries. Ultimately relapsed with my cancer. I went through treatment with a group of about 13 young adults, teens. I consider myself a young adult at 19, but others might think I was still a teenager. I acted like it, I think. But with that group of 13, it ends up, I'm the only one still alive. And so there's a lot of survivor issues. And I know for people in the military, there can be survivor guilt and survivor issues. So I got through all of that. Life was going good, got married. About 12 years ago, I started having some issues, which later I discovered was anxiety. I didn't know it at the time. I'm a chaplain, right? I should know all that stuff. And I ended up in the emergency room one day at work. I walked over to the emergency room, and basically they checked me out and said, you know, it looks like anxiety. So that started the journey. I eventually really, that was where I went into my first depression of episode and anxiety. My wife talks about, she just saw me in a way disappear, talks about a green chair in our living room. She said that you just disappeared into. I spent a lot of time in that chair, and it was a really terrible experience. I tried some medications, they didn't work. And I needed help, and I did the best that I could. But so anxiety, depression resulting from trauma was my experience.
I think, especially so often in this organization, we talk a lot about veterans and the things that they experience during their service, but oftentimes we have things, you know, before we turned adults that really affect us and our mental health. I'm glad you brought up your experience with chemotherapy and things like that. My son is actually a cancer survivor, and we focus so much on the treatment for the medical ailment, and oftentimes we don't think about how that affects you after. So we actually have put him in counseling and things like that for the fact that he does also have anxiety. It's a stressful process. You have a lot going on. There's doctors everywhere. So, you know, it's definitely important to focus on your physical health for that experience, but also focus on your mental health. What barriers did you have when it came to seeking treatment? Did you have any barriers, and did you have any concerns when you thought about seeking treatment?
My biggest concern or barrier was denial. I mean, I just kind of thought, hey, you know, I've been through all these things. I survived. You know, life's great. Trying to convince myself. And so I think that prevented me for a long time from being honest with myself and saying, you know, this really is probably mental health related. And I work in a field that does a lot of mental health. I talked with coworkers who were in the mental health field, but I think I couldn't admit to myself that, yeah, I need help. There is definitely societal pressures that that make it hard at times to seek mental health, especially when one hears things like, you know, growing up, oh, you know, they go to a shrink, you know, and I grew up in a town with a mental health hospital, and there were all these, you know, kind of derogatory terms, and so some of that was there. Depending on your religious tradition, there might be a lot of pressure to just seek more of like a spiritual healing, because that's real faith versus needing, you know, professional help. But those were really my barriers. They were mostly internal. It was me needing to say, I need help.
I think we see that a lot, especially in this community. Myself, even I've denied the fact that I have my own issues related to my military service. And as a veteran, it can sometimes be really hard to just admit that, not just veterans, but also those that aren't veterans. Dr. Earls, I would love to hear a little bit more from you. We've definitely talked a lot to Brian, which I love, but I would love to hear if you can talk a little more about how hard is it for veterans specifically to seek treatment, and what are some of the unique challenges that they face?
Absolutely. That's such a good question. I think holistically, it's difficult for anyone to seek treatment. We know that there are over 150 million Americans living in areas that not have access to mental health specialists. So these people need mental health services, but they don't have access to treatment. And so what this creates is sort of a funnel effect where a lot of people are seeking mental health treatment from their primary care clinicians, because primary care clinicians, you can get into those offices a little bit easier. And as a part of the medical affairs team, one of my big jobs is talking with healthcare providers every day. And so I talk with healthcare providers in primary care who are struggling to keep up with the demand of mental health services that people are seeking. And so what does that mean for patients? It usually means there's a really long wait time to get into mental health specialists, which can act as a barrier to treatment. But then if you add the other layer onto it, if you are a veteran, there are an abundant amount of internal and external barriers that can make seeking treatment very difficult. Some of the internal barriers is knowing when you need help. How do you know when you've hit the point where you actually think you need treatment? And as Brian mentioned, overcoming the stigma of mental health. We hear about that a lot in veteran patient populations. And then external barriers. So lack of transportation. Can you get to your appointments? Insufficient information on what is available. Other responsibilities. So, we have to take care of ourselves, but usually we have to take care of others as well. So how can that prohibit you from seeking treatment? Cost or insurance, many things like that. So, it's very difficult to seek treatment as a veteran, but I do think it's important to mention that seeking treatment is the first step on the road to treating mental illness. And it's a challenging step. There are many barriers in place, but it's a very important first step that people should try to take if they can.
So true. And I'm so glad that you brought up the transportation issue when it comes to seeking those healthcare services. We know just from many studies that when it comes to veterans that are experiencing homelessness, that lack of access to their healthcare services is a very big contributing factor. If you're not treating those, whether it be physical, mental, a combination of both, as we know that things can intermix, it can really present a huge issue when you're trying to access those, when you're trying to seek gainful employment and when you're trying to afford your own domicile. So that's an important issue to bring up. So we hear all the time about, veterans being, prescribed just lots of medications and things like that. So I would love to hear some more, Dr. Earls, about how clinicians are traditionally prescribing these mental health medications.
Absolutely. So after an initial diagnosis, when you go in to see your healthcare provider, usually they'll provide a diagnosis of what they think is going on. So after that point, clinicians will take multiple factors into account when selecting a mental health medication for you. So they'll take into account your age, lifestyle, if you're allergic to any medications, and family history. And they use all of this information in conjunction with their clinical expertise to select what they deem the most appropriate medication for you. You may have also gotten questions before asking if you have a parent or a sibling or a child that has been diagnosed with something similar as you, and if so, what medications had they taken? And the reason that you may have been asked that before is because if your family member has taken a medication that has worked for them, there may be a chance that it could work for you as well. It's not a guarantee, but it is something that they can think about from a genetics perspective. So when they're asking those questions about your family, they're also trying to take into account potential genetic factors as well.
That makes a lot of sense. Brian, did you go through trial and error with medications? How was that process? How did you feel through that?
I think Dr. Earls did a great job of describing it from the medical side, and from the patient side, that's exactly what happens. You go to the doctor, you finally, in a sense, get yourself up for the experience to say, I need help. And they ask these questions. And as a patient, it feels like they just throw a dart at a dartboard and say, let's try this. So I've been through trial and error. I think it's 7 different medications that I tried. The first medication that I tried when I finally said, hey, I really need help, actually threw me into like full-blown panic attacks that I'd never had. And that happened within a few hours of the first dose. That was demoralizing in a really big way. Kind of recovered from that. We tried another one that actually I was able to get on and it worked. The second time through, I went through trial and error. I ended up trying 4 medications. And that was really not fun. Each medication I would react to, I felt more hopeless, and I ended up just thinking, is this just how I'm going to have to live with this kind of anxiety and depression that just hangs there all the time? And I've done all the non-medical things. I've done mindfulness. I've done breathing. I've all of the things that they recommend that you do, but it just wasn't working. And I was just feeling really down by the end of the trial and error, and just felt a little bit like the doctor didn't have a clue, but just kept trying, hoping somehow we'd pull something out.
And to Brian's point, there is studies that back up exactly what he said. One of the largest studies of its kind look to see with each medication that you try when treating depression, what is your chance of remission? Does the chance go up? Does it go down? What are your chances of alleviating those depression symptoms? And what they found is that with each medication that you try, the likelihood of you achieving remission or addressing those symptoms actually goes down. But what goes up is the rate of side effects. So the more medications you try, your likelihood of side effects continues to go up. So that study was the first of its kind, the largest of its kind, that showed that this trial and error process when treating mental health conditions can be very damaging for the patient. It can be hard for the clinician as well, and especially when trying to form that relationship with your healthcare provider.
It makes a lot of sense. I mean, I can't imagine how disheartening it can be to try to go through all of that, hoping that a medication that you're given by a doctor that you trust is going to make you feel better, and then it makes you feel worse, or you have terrible side effects, those types of things. I'm sure that is awful to go through. So let's get into the real bread and butter of what we're here to talk about. We heard a little bit about the GeneSight test from Brian and how he took it and it has helped. And so I would love, Dr. Earls, for you to tell us, what is this test? Tell us all about it.
I would love to. So to kind of start from a 1,000-foot view, when we talk about the GeneSight test, what we're talking about is a genetic test. And so I kind of want you to think of this in the context of if you have a friend or if you have a sibling who's taken a medication, and let's say it was successful for them. So then you try the medication. You may have a very different reaction to that medication. You may have different side effects. You may feel like it's not working as well. It may make you feel groggy. And so the point is that patients who take identical medications, even at the same dose, have very different responses. And one of those reasons that those responses may be different is due to your genetics. So we have thousands and thousands of genes in our bodies, right? They do all different jobs, but there are certain genes that are there specifically to help metabolize or to break down medications, or they help medications do their job. And so the GeneSight test looks at those genes. We analyze genes that have been scientifically supported or scientifically shown to affect medication response, so how a patient may respond to a medication, or how a patient may break down a medication. And so what this test can provide for your healthcare provider is specific objective information to you. Your genes don't look like my genes, they don't look like Brian's genes. Everyone's genes are different. And so the GeneSight test can account for that. And we mentioned, we talked about how are medications prescribed historically, or what is the kind of the current standard of care. There are a lot of factors that go into it, but this one here is a factor that will never change because your genes are your genes and they're going to stay that way your entire life. So I hear from clinicians a lot. A big part of my job is just educating people on the GeneSight test. And so clinicians will use it to help them with the medication selection process, to learn what medications you may be at increased risk of side effects for. And really, it's just meant to be a tool that a healthcare provider can use to help with this medication selection process, because we know it's very challenging. And probably what I like to hear most when I talk to healthcare providers is some of the ways in which it's helped them with their patient relationships. So it can really help you take a proactive stance in your treatment. So it helps kind of a therapeutic alliance between patient and provider. And I can talk about the science behind GeneSight till we're blue in the face, but I feel like it would be much more valuable with our time to hear how it actually affected a patient. So Brian, I'll turn it over to you.
Yeah, so I was at the point where I wanted to give up, and I thankfully gotten an appointment with a nurse practitioner in psychiatry, and she was very understanding, compassionate, And she finally said to me, she said, there is a test that we could try. And I said, oh yeah. And she said GeneSight, and she told me a little about it. One of the benefits that I had, because I worked in healthcare, is I knew about genomics, and that this was kind of like the future of medicine, right? So in my mind, I thought, well, why not do a genetic test that might tell us something? So I was actually all for it, and didn't really have any reservations. So I said, yeah, let's do it. There was a feeling of what do I have to lose? I'd just gotten to that point, like nothing worked. It was always a bad trip. It was, calling the nurse, going to the emergency room because having reactions to the meds, and my wife's frustrated, I'm frustrated. And it was just like, yep, I'm going to take the GeneSight test. So that was my process.
And how did you feel going through the process? What was the process for you?
It was really easy. So remember, this is 7 years ago that I did it. At that time, I did it in the office, and so after it was ordered, I sat down with a nurse, and she got out the kit, and I swabbed the inside of my mouth, and she packed it up, put it in, and said, we'll put it in the mail. And it was for me really anticlimactic. Like, that's it. I mean, I swab and this is going to tell us all about my genes. And then it was like, I was anxious. I was really anxious what it was. I mean, I'm anxious to begin with, but then now I'm anxious. What's it going to tell us? And it's going to tell me to try another medication. And I don't want to try another medication because everything's just been terrible. I don't want to go through this again. And it took about a week to get the results back. But yeah, I was at a point where I just had test anxiety.
I mean, it makes a lot of sense. I mean, when it comes to tests, period, a lot of us have anxiety, and then couple that with, actual anxiety, and it can be extremely stressful. So Dr. Earls, can you tell us, is the process that Brian went through the same process that it is today? Has anything changed?
Great question. So it is still a buccal swab. So you take 2 little Q-tips, you rub them on the inside of your cheek for about 10 seconds on each side. You can do it in the office the way that Brian described his experience. The healthcare providers do have access to these kits, but you can also do it at home as well. So as a result of the pandemic and people being home a lot more, telehealth becoming much more prevalent, we created an option to take the test at home. So the doctor will order the test for you, and it will be shipped directly to your house. It has this beautiful little trifold folder that explains each step. You can do the swab yourself, and FedEx comes and picks it up. So there are kind of 2 ways now that you can get the GeneSight test. The turnaround time, so about how quickly you get it, once our lab receives it, it's about 2 days, 36 to 48 hours. So the turnaround time is pretty quickly, but generally the same. No blood draw, no nothing like that, just a quick little swab of your cheek.
And so as we are doing cheek swabs, that obviously means DNA, and we're doing a GeneSight test. What happens to these DNA samples? I know that a lot of, not just veterans, but just people in general are very concerned about, their DNA and where their DNA is being stored, all of those types of things. So what happens to that after you take the test, and how do you ensure patient privacy?
Such a good question. I'm so glad you brought that up. So we take privacy and security very seriously at our company. So we receive the cheek swabs at our lab, and we analyze all of the results within the confines of our own lab. So what that allows us to do is ensure not only quality, but security of your test results. We remove all personal identifiers from the sample as soon as the sample is run. So what that means, we remove your name, we remove your date of birth, we remove anything that could identify you as a person. And then after 60 days, all the samples are destroyed. The reason that it's 60 days and not sooner is we just want to make sure that the sample was run sufficiently. We had enough DNA to be able to run it. So we usually give ourselves that 60-day window, but the samples are disposed after 60 days. And as a patient too, if you're still not comfortable with that, you can withdraw consent at any time. So what that means is you could reach out to our lab and say, I sent in my test, but I don't feel comfortable anymore. We will halt the process and stop it dead in its tracks. So we de-identify all of the information, and then we end up destroying the samples. So we take very, very seriously how the privacy that you deserve when doing a genetic test.
That's great to know, and I'm sure that a lot of our viewers feel very good to know that it's not just, you know, stored forever, that their personal DNA is taken care of. Okay, Brian, so we've gone into the appointment, we've done the swabs, we've taken the test, and now it's time for our doctor to call us back in and talk to us about the information that has been given. How easily did you understand the report? How did your doctor go over it with you, and how did you feel after they went over all of that with you?
It was very easy to understand I'd call it the face page, the red, the yellow, and the green columns that that are on there. And then there's a whole bunch of information attached to it that she went over too, like all the individual genes. And honestly, I don't care. I don't understand all that. So that first sheet just really laid it out. It was very easy for me to see that in my green column, there were 2 medications. And my understanding was those were ones that would be well matched to me. All the other medications were in the yellow and the red, and it instantly made sense to me why everything had just been a bad experience. My genes just didn't like these meds. So one of the things that she said was, look, there's 2. At the time, one of the meds for some reason was kind of like not available. That left one real medication. And she said, you know, I would never have tried you on that medication because I'd previously taken another medication that is related. I mean, that first one that I took, it was not a good experience at all. So that was the original medication created by the drug companies. They knew that people had the reaction to this, and so they, in a sense, re-engineered it. Maybe Dr. Rolls will say a little more about that, so that it didn't have the same reaction profile. And she said, because you had the reaction to that first one, I would have never tried it. We could try it if you'd like. And I'm like, oh my gosh, what do I do? Anxiety kicked in again. So that was where we got with the report. Easy to understand, and then I'm there with, here's this drug.
And so how long, obviously there was a recommendation made after your doctor reviewed this report with you and possibly took the recommendation or another recommendation. How long did it take you to start seeing results after that change, and how did that impact your life? I'm sure that there was a good impact.
I left the office that day, and I didn't even ask, and the nurse practitioner didn't even offer to start. I think she knew that I was that hesitant about trying another med. And so I went home and I talked it over with my wife, and I'm sure by this point, my dear wife was just going, just do it. I'm sure that's what she was thinking. And I was so nervous when I called back. I finally called back and I said, look, let's try this med. And I mean, I'm a chaplain, okay? So I asked the nurse who took the call, I said, will you pray for me? I mean, I was that nervous. And so I started the med. The first night I had a little side effect stuff, which of course started freaking me out. The second night, not a problem. Didn't even think about it then. And probably for me, this is very unusual, but probably within a week or 2, I felt a lot better. And most meds don't work that fast. I know that and I understand that, but in my case it did. Within a month or 2, you know, I didn't have the same anxiety. I didn't have the same depression. My wife even said at one point that it felt like kind of I was coming back, which made me realize that something really was working, and it was encouraging, and it made me feel like all the struggle, these 7 years of trial and error were worth it. And now I'll say sometimes to people, hey, there really is better life through chemistry, and I'm all for it. So it worked. I've now been on this med for over 5 years. I've not had a relapse. Seasonal affective disorder. Yeah, January, February is still tough, but I can make it. I always fell apart February into March. That was when I would have all of my crises, and I don't have that happen now.
Wow, that is amazing. I'm sure that after 7 years of trying things and them not working, as we talked about earlier, the chance of another medication failure was fairly high. So the fact that it worked so well, that's absolutely amazing. So we've talked a lot about your experience, and this test seems like it would help a lot of those who are trying to find that right medication after, lots of medication failures, as Brian has talked about. Have there been any studies to validate GeneSight?
Yes, I'd be happy to speak on that. So Caitlin, if you want, you can pull up what the report looks like. So maybe people can see kind of when we're talking about green category, what that is referring to. But if you're able to do that, great. If not, no big deal. But while we are doing that, I would love to talk about a recent study that is really relevant for veterans, actually. So there was a recent study that came out this summer. It was a nationwide study of almost 2,000 veterans, and it was conducted at 22 VA sites across the United States. So an important part of, an important part of this study is that it was conducted independently. So it was funded by the US Department of Veterans Affairs. And our company, the only part we had in it was we just provided GeneSight testing for veterans. So this study was published in July in a journal called the Journal of American Medical Association, and it's known as the Prime Care Study. So if you ever want to look it up, just you can Google Prime Care and it will come up. And it was the largest pharmacogenomic, so genetic study that was conducted in mental health, and it was within your own backyard. It was amongst the veteran population. And basically what they found with this study is that patients whose doctors or healthcare providers had access to the GeneSight test had a 28% greater likelihood of achieving remission from depression compared to those who received the standard of care. So what's an important factor to kind of take into account there is there were two groups of patients within this study. Both of them were receiving treatment for their depression. Both of them were receiving, trying to get on a medication to help treat their depression. But then one group also had the GeneSight test to help with that process. And so those patients saw improvement in their symptoms, improvement in response rates, remission rates when GeneSight was used, which was wonderful. We also saw that patients whose clinicians had access to this test were less likely to be prescribed medications with what's known as gene-drug interactions, so predicted gene-drug interactions. So in order to explain this a little bit further, I do want to kind of focus your attention on this report that Caitlin has kindly pulled up for us. So this is an example of what the GeneSight report looks like. So when you hear us talking about those different colored categories, this is what we're referring to. So you can see here that there are 3 different colors. We have a green, yellow, and red. If a medication falls into the green category, what that tells your healthcare provider is that these medications can be used as directed. There are no known genetic reasons why these medications shouldn't work. There are, of course, as I mentioned, a lot of factors that your clinician will take into account when selecting a medication, but this talks specifically about your genetics. So when Brian was talking about how he only had a couple of medications in the green category, this is what he was referring to. If you see medications in the yellow and the red, what that tells you is we detected a variation in one or multiple of your genes that affects how these drugs do their job. And there's information that your healthcare provider needs to take into account if they still would like to prescribe them. And so some people think of this as a stoplight analogy, but I think it's important to note that, so green would mean go, you carry on, you prescribe as you normally would. In Georgia, at least, which is where I'm located, you yield at a yellow light, but you can continue on, and you can still take a right turn at a red light. So you just have to stop and pay attention and then take a red light. So these categories aren't prohibitive. They're just providing you information on your specific genes. So when the results of the study showed that patients who had access to this report were more likely to be on medications in that green category than the yellow and the red. So a lot of words just spewed there about this study, but the largest study of its kind conducted in a veteran population showed that when providers have access to this GeneSight test, that it can lead to more positive clinical outcomes for you guys and help with the treatment of depression. So we are really excited about that study.
That's amazing. And I mean, it's just like Brian said, I mean, he tried all of these medications and it's after 7 years. And I'm sure that there were most likely quite a few that were in the red or the yellow that he had interactions with. And then he tried one, which again, from his story was related to one that he had already had an interaction with, but it was listed as green. And I'm not sure if that's the one that he chose, but it's just great to know that like there are so many that most likely will not work with us, and there's probably a slim few that will just be more likely to work well with us.
Yeah, so it's just providing insight into how your genes may affect how these drugs work. And like I said, your genes are yours; they're yours for your lifetime. So it's good information to know for the life of the patient. So it's a wonderful tool, and I'm so proud to say that it has been shown to be beneficial in a veteran population specifically.
That is amazing. We appreciate and knowing that. That's great for us to know. I'm going to stop sharing.
Yeah.
And how does this test compare to other tests like it?
Yeah, absolutely. So there are other pharmacogenomic tests. And when I say the word pharmacogenomics, it basically means a genetic test to look at how medications may be affected by those genes. So that's what the word pharmacogenomic test, that's what that means. So there are other pharmacogenomic tests out there, but not all the tests are the same. And in fact, many of them are very different. There are differences in terms of what genes we look at. There are differences in terms of how well studied this test has been. Has it been looked at in different patient populations? Is there strong clinical evidence behind it? And there's differences in the science. And so one thing I can say about the GeneSight test is that we have the strongest and most abundant list of scientific evidence. We have done many studies, the largest clinical trials in this space supporting our test. And if you have specific questions on other tests or other pharmacogenomic tools available, I should have pointed this out when you were sharing your screen, Caitlin, but there is a 1-800 number and an email address at the top of every report. And that is a resource for patients. So if patients ever have questions about our test, a competitor test, anything about pharmacogenomic testing, they can call that number free of charge to set up an appointment to speak with a genetic counselor to ask those questions. And you don't even have to have had a GeneSight test to ask those questions. It's just more to learn what it is, what it isn't, any differences between us and others. So we try to put those resources in place for clinicians, but of course also for patients as well.
That's great. That's great to know. So if anyone in our audience is interested in taking this next step and seeing what medications they are more likely to be compatible with, or medications that they're not compatible with, where do they go? Where should they seek more information?
Great question. So first, they should talk to their current provider to see if they think that if the GeneSight test is right for them. So you can talk to your primary care provider. If you are seeing a mental health specialist, you can of course talk to your mental health specialist as well. If their current provider orders the GeneSight test and then thinks it's appropriate for them, then they can request it from that provider. If they don't have a provider that offers the GeneSight test, they can visit our website. So www.genesight, GeneSight.com. And I will put a link in the chat for a tab specifically that says it's called the Find a Provider app or tab. So you can look to see where the closest provider to you is in your geography that does use this GeneSight test. So the first step is always start with your healthcare provider and go from there. But I will provide this link in the chat so everyone has access to it.
Excellent. Thank you. Thank you so much for all of that information. Brian, I'd like to kind of round out the questions that I have with asking you two other questions. What would you say to a friend that the GeneSight test has meant specifically for you?
Mm-hmm. What I would say to someone is it is a really useful tool to help minimize the trial and error. Genetics can tell us so much about how our bodies are going to react, and it gives just really helpful information. And for me, it worked the first time. I mean, the first med I tried after getting the information from the test, that medication matched me, and I've been successful on the medication. It really helped to take care of anxiety and depression. I still needed to do all the other work that I need to do in my life, meditation, breathing, journaling, all of those things that make for a really good holistic approach to taking care of oneself. But without that GeneSight test, I just don't know if I would have ever tried another medication. And I'm really grateful for the test because I feel like it made a world of difference for me.
And what can you tell our audience about taking it? Maybe somebody who's, on the fence or maybe feels uncomfortable with giving. I mean, we talked about the privacy, but still some people may be a little concerned about that. What would you say to someone in the audience that might be on the fence?
The benefits outweigh the burden of whatever you're worrying about. Your mental health is way more important than some of the concerns that you have. And when you get the right treatment plan, including the right medication, and you feel better, it's worth it. In my role, I often do suggest to people, they're in the hospital already, they're struggling with an illness, and then you layer on the mental health part, and I'll suggest to them, you don't have to do this process that's been there, and they're going through the trial and error. And I'll encourage them, there is a test called the GeneSight test. Talk to your primary care provider. We don't do them in the inpatient setting, but we help set people up to get back to their provider. So that's become part of my own work, is helping people realize there are other resources. I give them a wide range of resources, but one of them is to encourage them to connect with their primary care physician about GeneSight.
That's amazing. And again, like we said a little earlier, it's important to remember that even as you go through physical medical conditions, that can also impact your mental health. So don't ever think that there's something wrong with you if you want to seek out mental health care. There's absolutely nothing wrong with it. It is a good tool to use. I would love to get some questions from the chat. I'm sure we've had a lot of information thrown at us and a lot of great things talked about today. So I would love to know if there's any questions from our audience.
Yes, thank you, Caitlin. This question is for Dr. Earls. What about the sample data that is taken? Is it purged after 60 days? Because there are legitimate concerns regarding the data being used for criminal investigations or paternity determinations, for example, without consent.
So I think I caught all of that. So the question was, is the sample destroyed within 60 days? Am I getting that correctly?
Correct.
Yes. So the samples are completely destroyed. One thing that I can share that may bolster your confidence in that process is that the science of genetic testing is always evolving. So our test updates as the science becomes available. And so due to the fact that if we add more genes to our panel, we actually have to reach back out to healthcare providers to have them re-swab their patients because we don't have access to their swabs anymore. So yes, they are destroyed within 60 days, and no, they are not used for anything other than pharmacogenomic testing, no paternity, no anything like that. And I just also want to say that that's a very fair question. You know, you have every right to ask that, and you have every right to be an advocate for yourself when it comes to privacy and security. So we feel that way very strongly within our company. And so yes, the answer to your question is we do destroy them.
Thank you so much. This next question is about law enforcement. Is this test doctor-patient privilege? Because a psych test like this can potentially have officers put on desk duty for sometimes months. Is there a knowledge base addressing support groups for law that they can have access to tests like this?
That's a great question. So our company is HIPAA compliant. So that means that we protect patient information. And so this test is subject to patient provider confidentiality, just like many other pieces of your healthcare are as well.
What a great conversation. I mean, what a great question, honestly. I mean, in the veteran space, we talk a lot about veterans not feeling comfortable seeking out mental health care services, active duty. But I mean, also we hear a lot about law enforcement not feeling comfortable seeking out mental health care services. So that I definitely would like to applaud the person who asked that question.
Yes, I agree. These are, you know, questions that need to be discussed to increase the comfort of using something like this. So I agree. Hats off to you guys for asking this.
Thank you. And one last question. Depression is causing me to be unable to write. I am a novelist. I'm also a PTSD post-treatment person who has it under control currently. Would you still recommend this option of taking this test, and may it help me? Is it possible that it'll help me get back to writing?
Yeah, so this test is for patients with mental health conditions. So most of the studies that we have that support using this are for patients with major depressive disorder. So if you are suffering from major depressive disorder, it's prohibiting you from doing the things you love or your work like writing, I would absolutely recommend it. And one other thing I should have mentioned before is that in the VA study that I talked about, you know, people in order to be in the study had to have major depression, but about 58% of the patients in the study also had PTSD. So these patients did not just have depression in a vacuum, they suffered from anxiety, PTSD. So there are people who look and feel like you who were in that study as well that did show a clinical benefit from having the GeneSight test. But again, of course, I would talk to your healthcare provider first and foremost.
And on a personal note, I completely hear what this person is asking, because depression just takes you away. It minimizes who you are. You don't have the energy to do the things that you love. And once you find a treatment plan that works and you start to refine yourself, it is so rewarding. And over the past, 5, 6, 7 years, I've really re-engaged in so many parts of life that I realized I just let go because I didn't feel like it. I wasn't functioning as Brian. And so I guess Brian's back, and it's a good thing.
And we're so glad that you're back, Brian, and here to talk with us about your experience and how this has helped you. And hopefully hearing about this can help even more, not just veterans. We have, we have military families also on our page, and veteran supporters. So hopefully this can help anyone who is struggling to find something that works for them, or maybe somebody who hasn't even started their journey, and this will prevent them from having to go through all of that heartache. We've had a wonderful conversation today. Dr. Earls, I'd love to give you a chance to share any closing thoughts, closing remarks, anything that you think that wasn't talked about today that should be.
Well, I think my biggest closing remark would just be general gratitude. Thank you for the people listening. Thank you for your service. Thank you for all that you've done. I'm humbled and honored to be able to speak with you about this today. Please use our website. It is full of great information if you have questions, points of contact if you want to learn more. But ultimately, I just wanted to say thank you. And thank you, Caitlin, for having me.
Thank you so much. And Brian, do you have anything that you would like to share before we close?
I feel like it's just really cool to have this opportunity to talk about mental health, my own mental health, and that might impact others. And I too am very grateful for all the veterans who've served. I get to work with veterans in the hospital. We're not a VA hospital, but amazing stories, people who are really working to be healthy. And so if there's any way in which I can encourage you to try the test, I want to do that because it can be very important part of getting back to a full, healthy, vibrant life.
Definitely. I wholeheartedly agree. I want to thank everyone who joined us today. I want to thank Myriad Genetics for joining us in this conversation, and Dr. Earls, thank you so much. You have given us so much good information and so many things to think about. The mental health journey is a very stressful one, and we've heard one experience from Brian today and how it has helped him through that process. And would just love to encourage anyone that is interested in learning more to reach out to their provider to talk about this test and see if it's a good fit. Additionally, like we mentioned earlier, if you are in a spot where you feel like you need to talk to somebody, you are struggling with your mental health and you don't exactly know who to reach out to, IAVA is here for you. We always say we've got your back. So you can reach out to IAVA's comprehensive case management program. As I said before, the Quick Reaction Force. You can go to quickreactionforce.org or dial 1-855-91-RAPID, and you will be in touch with someone immediately. That's 24/7, 365, doesn't matter what time of day. If it's 3 o'clock in the morning, if it's Christmas Day, doesn't matter, they're there. Additionally, if you need, like I said earlier, immediate help, please feel free to reach out to the Veterans Crisis Line at 988 and then press 1, or you can text at 838-255 and talk to someone immediately. Thank you again for everyone that joined us today. We've had a great conversation and hope to see you on the next one.